Hello everyone, this is James and welcome to Lectures. Today we'll explore the levels of prevention. Let's start with the primordial prevention. Primordial prevention precedes primary prevention, and the aim of this level is to prevent the development of risk factors. The target population is the entire population, and the activities are mostly policies and programs. The policies or the programs on healthy eating, sleep hygiene, and regular physical activity prevents the development of risk factors for cardiovascular diseases, or the government policies on raising taxes on cigarettes to discourage the people from smoking, which in turn can prevent the development of the risk factor for lung cancer. After primordial is primary prevention. Primary prevention prevents the occurrence of the disease, and the target population are healthy individuals. The activities include immunization, hand washing, use of condoms to prevent sexually transmitted infections, prenatal care, regular dental care, nutrient supplementation, and prophylactic surgeries such as bariatric surgery to prevent the complications of obesity and mastectomy for certain women. So these women do not have breast cancers, but they have genetic mutations which predisposes them to breast cancers. Let's talk about secondary prevention, which accentuates the early disease detection. The target population are healthy individuals with subclinical forms of disease, meaning to say you are healthy, you have the disease, but it's not manifesting yet, so there are no signs and symptoms yet. And the activities of this level are mostly screenings, blood pressure screening. You also have um, pap smear for cervical cancer screening, colonoscopies for colorectal, and mammogram for breast cancer. If you have a fish or you have an aquarium at home and you want to screen the fish for breast cancer, you can do mammogram. And now let's talk about tertiary prevention, which reduces the impact and severity of the disease, or it will slow or stop the progression of the disease. And the target population are, of course, the symptomatic patients. And the activities are rehabilitation, that is PTOT, post-burn or post-stroke, cardiac rehab for post-MI patients, diabetic foot care, and chemotherapy. Now let's come to the last level, which is quaternary prevention. This prevention avoids or lessen the unnecessary or, or excessive health interventions. And the target population for this level are those who are vulnerable to overtreatment or over medicalization. And that includes number one, patients with illness without the disease. So what does it mean? You are ill but you don't have the disease. Example, back pain, chronic back pain. You are ill but the provider cannot cannot link that back pain to a biological disease. There is no nerve root compression or any muscle injury. And these patients are vulnerable to over medication and over imaging. You have to do a lot of imaging. And another target population for this level are those with incurable diseases such as cancer and Alzheimer's. And then for radiologic incidentalomas, So you do an imaging and then you found a lesion or tumor of dubious significance. So what you're going to do another imaging, do biopsy, and these patients are prone to over medicalization or over treatment. And the last one are those patients who are receiving medical interventions that um, causes harm than good. For example, giving antiarrhythmic medications post MI, it reduces the arrhythmia, but it also causes high mortality. Or if you are receiving a hormone replacement therapy that can lead to um, breast cancer, that are linked to breast cancer and thromboembolic events. And what are the activities for this level? So these are mostly guidelines, protocols, follow-ups, or a collaborative effort between the patient and the provider. That is all, and I hope you learned something from the levels of prevention.